In this part 5 of our presentation on therapeutic applications of light, we'll be looking at how, in the same way as light can be very beneficial for health, it can also be unhealthy. And we'll look at a subject that could be called light hygiene. Now, whenever you talk about the effects of light, the ultimate reference is always the solar spectrum, because of course life evolved on Earth under this solar spectrum for billions of years. So we are totally adapted, finely adapted to this particular spectrum of light. And we know, as we described in earlier parts of this presentation, that the blue light of the spectrum is especially potent to affect our circadian rhythm, and that any excess of blue light in moments outside of middle of the day can disrupt our circadian rhythm. Now, to better understand how that could come about, let's look at different artificial light sources as compared with the solar spectrum, which we see here. So in the solar spectrum, you can see the our photopic sensitivity, what our vision is sensitive to. It's right in the middle part of the spectrum here. And you can see the circadian sensitivity, the sensitivity of these cells in the retina responsible for the non-optic, non-visual effect on the optic nerve. So quite different ranges there. And let's see how different light sources interact with these two spectrums. Here is a spectrum of an incandescent light source. And you can see what's striking is how much red and deep red it is. And this corresponds to heat. And as we all know, of course, incandescent lights are burning hot. So most of their energy is actually wasted in heat, and there's not that much in the visible spectrum. And this is precisely why we've been trying to move away from those light sources towards more efficient, energy-efficient light sources. If we look, for example, at the fluorescent light or fluorocompact, this is what the spectrum looks like, completely different. So you have rays, strong rays in specific colors. And you usually have a strong blue ray corresponding to the mercury atom. That's one of the main sources of light within fluorescent lights. So this it falls right in the middle of the circadian sensitive part of the spectrum. So you can see that this would have much more potential to disrupt the circadian rhythm than incandescent light would. We can look here now at an LED light source. So it's beautifully tuned to overlap exactly how our photopic sensitivity, but most white LED sources, if you look at their spectrum, have a strong peak in the blue region, because the light is actually produced by a blue source of light, and it's redistributed within the LED by phosphor coating to the other frequencies. So again, here we have a light source that has much higher potential to disrupt circadian rhythm. Another aspect that has to be looked into in relation with this is the question of light at night, LAN. And it's now found by researchers such as Professor Abraham Haim, that we see here, who is a colleague from the International Light Association, that there's an actual link between excessive light at night and cancer rates, for example, breast cancer rates in women or prostate cancer rates in men. And what that points to is the importance of regulating the amount of light, and especially again blue light, which is interacting with our hormonal system and which is at cause in these phenomena at night. So it's critical to use light sources which don't have excessive blue, especially at nighttime. Another aspect of blue lights, independent of this hormonal effect, is the fact that because blue photons have higher energy than the rest of the spectrum, they have more potential to cause oxidative stress in the retina, to actually damage retinal cells. And this is a cumulative factor. It adds up gradually over a lifetime. So it's not immediately obvious, but the higher the proportion of blue light, the higher the intensity of blue light that you're exposed to during your life, the more you have potential for this oxidative stress in the retina. And there is a suspicion that this could be linked to the increase in macular degeneration, that's observed now. And that could be related to the new light sources that we've been using for the past few decades, fluorescent lights and now LED lights. So there is some concern in that respect. Here you have a graph showing the relative irradiance factor in that range of the what's called the blue light hazard, this oxidative stress effect of blue light. And you can see that incandescent lights have quite low coefficient. And also the same with LED lights with low temperature, correlated temperature. Temperatures are below 3000 degrees Kelvin. Same with halogen. So these lights are the best in terms of minimizing these blue light hazard effects. But now if you look at higher temperature LED bulbs, which would mean the more bluish looking, brighter white blue looking LED bulbs, or fluorescent lights, they have much stronger factor for blue light hazard, so much more impact at that level. So these would be to avoid as much as possible in our daily life. Another aspect that is related to that, we talked about how Professor Carew discovered how light can affect our cells through what's called the photobiomodulation process, whereas light stimulates ATP production in the mitochondria of our cells and contributes to increased cell metabolism and DNA repair and cell regeneration. So these are very healing effects of light. And what Professor Carew found was that they're more important in the deep red and infrared part of the spectrum. Here we have the action spectra that she worked out of the relative potential effect of different frequencies for this photobiomodulation effect. And you can see that the most important frequencies are in the infrared range, so below visible light actually. And that points to the importance of infrared light in our light sources. So traditionally all our light sources, such as fire or incandescent lights, had a high content of infrared, as similarly to the sun. And now we realize that this infrared light has a beneficial effect, which is an important part of lighting. And the whole effort to remove it with energy efficient light sources exposes us to new dangers. This was reinforced by experiments such as one that was revealed to us by Dr. Eels in one of the light conferences I was at. And she showed how she could actually heal damaged retina in rats with red light, exposure to deep red light. And this was done by having the rats injecting methanol in the retina of the rats, which would normally lead to blindness. And just a few minutes of this deep red light was enough to counteract this toxic effect of methanol and prevent the occurrence of blindness. So it would appear that the infrared light that's contained normally in sunlight has an effect that's opposite to the oxidative stress effect of blue light and compensates the potentially detrimental effect of blue light. And this is what you have in sunlight and in incandescent lights, but you do not have this combination in fluorescent light or LED light. So this is something to be especially careful about, and it may be that in the future we'll find that we have to tune better LED light sources to restore enough of the infrared to balance the spectrum. In the immediate, if you want to protect yourself from the effects of the blue light hazard, you have different things can be done. For example, it's good to wear lenses that will block the blue light, especially at nighttime when you don't want to disrupt your circadian rhythm. So you have on the market different types of such blue blocking glasses, and you can see the effect. Here you have a typical spectrum from a computer screen, and after using the blue blocking glasses, you see that you've eliminated this peak of blue here. Another light-related risk specifically concerns LEDs, and this is the fact that many, if not most, LED devices we see around us use a electronic control technique called pulse width modulation, PWM. And this is used to dim the LED. Whenever you see a color changing device, or when you try to dim a light bulb, LED light bulb, most likely this is the circuit doing it uses this sharp pulsing of the light. And this is done at a frequency higher than the flicker fusion frequency, which means that you don't perceive it visually, you don't see the LED flicker. But because LEDs react very, very quickly within nanoseconds, you can use a high frequency to pulse them. And electronically, this is very simple. You need an inexpensive transistor switch, and you can then dim your LED light by varying the proportion of time where it stays on. Now, this would seem to be very nice and efficient, except for the fact that if you know about the frequency effects of signals on subtle energy and on our biology, you realize that pulsing signals do interact with us. And what you're doing with such light sources is creating a very strong environmental pulse that's continuous around you, and that adds to the environmental stress. So if you're trying to create a light for healing, this is definitely not the best way to go about it. And also this constant, strong, harsh pulsation interferes with whatever additional modulation you might be trying to add with beneficial frequencies. So this flicker-related risk actually has been documented, and depending on the frequency range at which you pulse, you have different types of problems. But these include visual strain and potential migraine increase for sensitive people. And so it's definitely not the best way to go about it. And the reason why it's done, again, it's because it's very easy in electronics term, and otherwise you need to use very precise analog circuits that are more complex and expensive. And this is what is done in the Sensora and Sensosphere. Finally, one last point of interest to note relates specifically to fluorescent lights. And this has been noted by Dr. Wunsch from Germany, a colleague of the International Light Association. And what he notes is that light emitted by fluorescent sources come from the mercury atom, ionization of the mercury atom, and so they are very strong rays of resonance related to the mercury atom. And we know that mercury is a toxic element. We all have a certain amount of mercury within us that we've absorbed through food and through the air, and the body stores this mercury on the outer fat layers under the skin to try to eliminate or store it away. And what you do when you are exposed to light coming from mercury atoms is that you have these resonant rays that are exactly the ones needed to reactivate the mercury that's dormant in your skin. So you kind of introduce a new source of toxicity through the ambient light. So this is a fact that is not so well known, and that would certainly benefit from added research. So we've seen all the different ways into which light can become unhealthy. So it's good to take care of the quality of light that surrounds us. Thank you for participating in this series of presentations on therapeutic applications of light.